on this computer. Right. So welcome everyone to the second episode of this podcast, which I've now named Microbiology Matters. My co-hosts today are Vicky and Amrat. And if we could start with Amrat, if you could please introduce yourself, what you do and why you've decided to take part in this podcast.
Thank you, Anthony. So my name is Amrat Khurana and I am a digital learning officer at Great Ormond Street Hospital, which means that I work with nurses and doctors to try and create education that's easily accessible to most people. So try and do it in an online platform. So, you know, there are learners that don't have to come into the hospital to learn. They can do it online at home or whenever they get some free time. So this is quite an interesting subject, fecal transplants. And I guess I'd like to know a little bit more about what it is, and the roots of transplant is my main question, just because I've come across this topic before and I've had conversations before, not actually knowing very much about it. So it'll be really nice to learn something new today.
Excellent. And Vicky?
So hi, I'm Vicky and I'm the Associate Director of Education in the Gosh Learning Academy. So essentially I work with Lynn and Simon on strategy. And the reason I'm here is because I have more questions about fecal transplantation than I have answers. And as I was just telling Anthony, I'm in the middle of cooking my dinner as well. So I'm interested to see how this affects my appetite at the end.
Excellent. I'm going to try not to laugh during this. So let's do a quick recap to give you some context about this. So in healthy people, the intestinal tract has a diverse population of bacteria which colonize and live there and take up space. So when patients are given broad spectrum antibiotics to treat infection, these also kill these beneficial bacteria. So if an organism called Clostridium difficile is present, I'm going to call it C. diff from now on because there's a lot of issues about what you should actually pronounce, how you should pronounce it, and I always get it wrong. So C. diff is present, it will multiply and take up the space that's left by the good bacteria after they're killed. So then C. diff then produces toxins, which basically inflame and damage your colon, causing severe pain, diarrhea, and vomiting, which is obviously very, very bad. This can also lead to what's called toxic megacolon, which is severe inflammation of the colon, and it causes it to really swell and can result in death. So obviously not good. So first line treatment is usually treatment with antibiotics, but you can get like a 20 to 25% relapse after you've used these antibiotics to try and kill C. diff. So sometimes it doesn't work. The organism can become resistant, and then you go back to having all the symptoms you had before. So this is where a fecal microbial transplant or fecal transplant comes in. It aims to replace those good beneficial bacteria that were lost. And after 2 procedures, it's 94% effective, which is really good. So my first question for you guys is, how do you think this procedure is undertaken if you had to guess?
You know what? I was thinking about this and I was making myself feel sick because there's 2 ways, I guess.
There is 2 ways, yes.
Yeah. I don't know. I actually came across a diagram a few maybe last year, you know, when I came across this topic. And I thought, oh, I'd Google a diagram, and I can't remember, but the way the diagram was constructed was that it goes in that way, which I can't imagine unless it. See, that's where my question is. If that is the case, are these samples, the healthy samples, screened because it's fecal matter, isn't it? It's
yeah.
Fecal. So
yeah, that's a good question. We're gonna come to that. You're right, there are 2 ways to administer the transplant, and donors are screened. So we will get onto that shortly. Vicky, can you perhaps?
I don't know, but I wondered if it was made into tablets almost. based on my parents using lion poo in their garden to stop cats coming in. They have lion poo capsules that they put in the garden, and then cats smell it. And so I just wondered if we do the same with human poo that we do with lion poo.
Okay, so I hope you guys aren't squeamish because I'm about to describe the process. So 60 grams is mixed with 250 to 300 mils of water. So I think that's half a pint. Sorry, saline solution it's mixed with. So it's homogenized by being shaken together, or often hospitals will have their own food blender, which they use specifically.
Yeah, you'd want to keep it separate.
Yeah, you definitely want to label it with Faecal transplant blender.
Don't want to make a smoothie in that.
Oh, that's one smoothie that you want to say.
So once you've made your solution, it then needs to be filtered through a gauze or coffee filter type gauze to remove the large bits. And then you normally administer it via the lower gastro tract by a colonoscopy. So the good thing about that is you can kind of see where you're putting it, and you can kind of make sure you target areas, etc. Or via a nasogastric tube, which obviously goes up through your nose and down to your stomach. So those are the two ways. There's advantages and disadvantages to both, which we won't dwell under, but that's the procedure. So questions, I don't know if that makes it better or worse for you guys. Like, do you think that's...
I think it makes it better than what I was imagining.
It's better than actually drinking it. I think you need to
Yeah.
Thank you, Vicky. Exactly, that's what I was saying. I didn't want to say it out loud.
I mean, we make children drink some foul medicines. You know, we make them drink saline. You know, we essentially make them drink salty water. Some stuff tastes really bad. But I think that's got a psychological thing as well, no matter what the taste is.
If you ever have to take the cholera vaccine, that is literally a drink that you have to drink. Just throwing that out there.
A lot of medicines that don't taste good.
I know, yeah, I can't imagine it doing so. So what would you feel comfortable asking your flatmate, partner, or family member to be your donor if you were ill? So often they say that if you live with someone that's closely associated with you, they're more likely to have your similar bacterial microbiome or bacteria that are normally in your body. You'd be exposed to similar-ish risks. It kind of reduces the risk. Would you feel comfortable asking, for instance, your flatmate or your partner or family member to be a donor? Or do you think this is just really gross and you'd find it really awkward?
It's got to come from somewhere. Someone has to produce it. I think in pediatrics, it makes real sense for it to be the mum.
Yeah.
Because there's a lot of evidence kind of around breastfeeding and the whole kind of process of being on skin to skin, sharing bacteria. So I think in the pediatric population, it makes real sense for it to be mum, because they all have, you know, most children will kind of have that same, microbiome as their family. Would I ask my partner? Yeah, why not? It'd be an unusual conversation and one I've not ever had thoughts about how I was going to address.
Yeah, over a glass of wine. Oh, by the way, can you please?
Can I have a little bit of your?
You know what? It's quite an off-putting subject, and it's definitely, like, you know, on the disgusting scale. But I wouldn't mind. I mean, I'd certainly ask a family member or a close friend. I mean, I'd probably ask a family member as opposed to a friend, just because, you know, they'd probably share more of the similar type of, you know, bacteria, or I don't know. But I'm not entirely sure how my family would react. My mum would probably say no, whereas my siblings might say yes, because it might be less disgusting to them. My mum's from a completely different generation, so this concept will be completely new to her. She's 70, so it was like, oh, putting my fecal matter into you will be really disgusting. But yeah, I would definitely ask, especially if it would help me.
It's because I suppose you're sick at this stage as well.
Yeah.
You're not well, and I think most families would do anything to help their family member if they were sick. You know, we're kind of thinking about, you know, if I was to ask my partner tonight, you know, I'm not I'm not sick. But if I was really sick, and I'm assuming you have to be fairly sick to go down this route.
Yeah.
Your parents, you know, especially yet again, if you think about the kids we see at Gosh, the parents would do anything to make their kids better. And if donating a bit of stool is what it takes to be, that's actually a lot better than what some kids go through.
Yeah.
Yeah.
Exactly.
Than donating a kidney.
So, Amrat, to kind of alleviate your fears about picking a donor, so they're usually screened in a similar way to if you were going to donate blood. So they'll test for hepatitis, HIV, syphilis, gastrointestinal pathogens such as parasites. Because if you can imagine, if you're putting in someone else's stool into your body, if they've got any parasites, any pathogens, that then takes the place in your colon. So ideally you want someone that's quite healthy as well. You don't want someone that has any chronic gastrointestinal disorders. And you don't want anyone that's high risk. No one that's had a history of antibiotic exposure previously, because you want someone that has a very diverse bacteria population in their body, because that's what's going to help you. So, third question, can you think of any treatment issues that may be a problem with this procedure, if you had to guess?
Does it work? What's the success rate like?
94% by 2 admissions, which is really good. They stopped the study halfway through because it was so effective.
Oh.
I don't know. Would it be in the category of being an invasive procedure? I mean,
yeah, I would say it's somewhat invasive.
Yeah.
Yeah.
Because I don't know. It's tough. Like, what if patient? I don't know. What if? I don't know. If an
NG tube's not going to be as invasive as a colonoscopy. You don't need an anaesthetic to get an NG tube.
Oh,
but I assume you're still going to have to come in because you're going to have to get an NG tube.
I mean, some of the treatment issues.
We all know hospitals are not good places to be, especially if you're sick.
So there's a risk of damaging the colon, I guess, if you're having a colonoscopy. There's just always that small risk. So that's a potential issue. One of the issues that was completely overlooked previously was it doesn't screen for antibiotic resistance in the donor stool. So you're screening for pathogens, etc., but you're not screening for bacteria that are really, really resistant. And if someone is very, very resistant, if a bacteria has large resistance and you're giving it to someone that has very low diversity in their gut, you're then basically colonizing them with bacteria, which could then, for instance, go into their bloodstream and cause bloodstream infections and can produce an even more dangerous infection. And that has happened. So there has been a few deaths linked to fecal transplant, and the FDA in America issued a warning to basically say, bear this in mind.
Also, there could be new viruses as well. I mean, December last year, you wouldn't have screened for coronavirus.
Exactly. And now that is probably part of the screening protocol for fecal transplant.
You didn't know it existed. You can't screen for something you don't know exists.
Exactly. Definitely. So I think my general thoughts about fecal transplant are that they sound really effective and quite easy to do. I mean, the thought does gross me out, but if that gets me off a hospital bed, or if I know someone that needs my poo, then I guess I would feel it would be quite difficult for me to say no. The thing that I'll remember about this podcast or about this topic that I didn't really know before was that this was actually described about 1,700 years ago by a Chinese medical scientist called Gi Hong, and he used it to treat people with severe diarrhea or food poisoning, which I had no idea it was that long ago. I thought it was very much a recent thing.
I was going to say, who came up with the idea recently? It does make sense, though, I suppose, if you're You have,
You know what?
the problem is it has no bacteria. You put the bacteria in there.
Yeah, definitely makes sense.
Yeah. Yeah, it's true. It's like one of those things. I mean, this is going completely off topic. It's like, you know, coffee bags. How like all of a sudden you could do coffee bags, and you thought, why didn't we think of this before? You know, with this
Yeah.
transferring healthy bacteria into like,
Yeah.
you know, like
It's true.
into someone who needs the healthy bacteria is really like. And you know what? There is more and more research. I know, like from previously coming across this topic, to suggest that, you know, our microbiota has so many different benefits to our health. And not just physical health, but mental health. And so I think if there's any new way of supporting people who are ill, and helping them get better, and it's not using antibiotics, then I think it's definitely a win-win.
I mean, there's a lot of studies with fecal transplant in relation to other chronic diseases. So in terms of autoimmunity, neurodegenerative disease, etc., there's a lot of studies going on to see how could this affect other conditions. So one fact that I found that was quite interesting was that you are more microbe than human. So if you counted all the cells of your human body, only 43% are human. 57% is what is called our microbiome. So bacteria, viruses, fungi, etc., which is quite shocking when you think about it. So,
Surprising though.
yeah, definitely surprising. So you can see how these things have such an impact on you, and the diversity changes depending on your environment, what you eat, what you drink, how you exercise, everything like that.
Wow, that's so interesting. And you know what? A lot of people don't realize that. I think if you say bacteria to somebody who doesn't necessarily have much awareness of medicine or science, then they just think, oh, bacteria is bad. But actually, you know, you realize there's a lot of good in some bacteria.
So this is a medicalized version of having one of those little yogurt drinks that my mum takes every now and then.
Like Yakult.
Yeah.
I think what we'll find is down the road that instead of doing fecal transplants, they'll identify the bacteria mix that is good to treat certain conditions, and it will be given that way rather than giving someone a whole chunk of stool that's kind of blended and given to you. I think that's the way it will end up going. But at the moment, I guess they're still kind of grappling with what they're doing. So if I could ask you what one thing you're going to take away from today or this session, what would it be? It could be anything. It could be, this is gross.
This is ingenious.
Mm.
I know it was like described by some Chinese guy, you know, a millennia ago or whatever, but somebody at some point in recent history has had the guts to stand up and say, I know, why don't we try?
Yeah. And you can
Some
imagine.
poor guy stood up at a conference somewhere and said, we tried this.
It's so true.
Vicky, I thought you were going to say pardon the pun then. Someone had the guts. Someone had the guts.
Oh, I never got that. Oh, God, yeah.
It's incredible. I think, like, you know, I mean, all of it, obviously I'm taking away because all of it is like new knowledge to me, but the success rate is incredible. And that's, you know, one of the more important things I'll take away with me in the future. If I ever have to have like anything of this nature, then I'm like, well, 95% is good enough for me. Was it 95%?
94.
94, sorry, 94.
We're all going to take a vaccine with the same kind of success rate. So why not fecal transplant?
It's true. Right, thanks guys for being part of this. I hope you enjoyed it. And
yes.
Yeah, definitely.
This again, it was interesting.
Yeah, definitely. And educate your friends. Have a chat.
Well, I shall tell them all to go do big poos. How does one become a poo donator?
So
are there poo donation sites?
So there is what's called, oh God, I think it's a company called Microbiome or something in America. And you can become one, but the criteria is quite strict. So I read that 90% of applicants are turned away.
Right.
Because they need a store every day for a certain number of days. So you have to be quite regular. You have to pass all the kind of checks and balances for donation. And then also they want people that have a healthy bacterial mix. So there is actual a healthy bacterial mix that is associated with, people that exercise a lot or are lean or have good glucose metabolism, all these things.
Actually, just on that, is there, so if you've kind of got like a not very healthy mix of bacteria, you can get a good mix by eating healthy or just changing lifestyle slightly. Is that right? And so you can change it all.
Yeah,
that's really interesting.
I think to some degree genetics plays a part in the way your body is. So there'll be only so much, in a way, I imagine, that you can change it through your environment, because there's always an interplay between the way your body works, what it produces, the hormones it has, and what you can do to kind of alter that kind of mix. So it's very much an interplay between environment and genetics, but you can make positive changes, definitely.
Great.
Thanks.
Can I come on another one of these? This is interesting.